Hey there, and welcome. Let's talk about something we all experience at some point, that feeling of uncertainty about our health. In this explainer, we're going to demystify diagnostic testing and show you how it can turn those nagging questions into clear, confident answers.
You know that feeling, right? Where you're just not 100%. Maybe you're tired all the time or just feel off, but you can't quite put your finger on why. It's this vague, frustrating feeling, and it's more common than you think.
And here's the thing, you're definitely not alone in feeling that way. Acknowledging that you have these unanswered questions is actually the most important first step you can take toward getting some real clarity. So, let's start right there.
Think of it like this. Those unexplained symptoms are basically signals. They're like your body's check engine light flashing on the dashboard. And yeah, that can feel a little unsettling, for sure. But really, it's just an invitation to pop the hood and see what's actually going on. It's not about fearing the unknown. It's about making it known. So how do we take that closer look? Well, this is where the hero of our story comes in, diagnostic testing. This is the incredible tool that lets us turn those vague feelings and questions into solid, concrete information you can actually work with.
So, what are they, exactly? You can think of diagnostic procedures as a really detailed status report for your body. These tests measure how well your organs and all your internal systems are doing their jobs, giving you and your doctor a super clear, objective picture of your health. And you know, this isn't just for when you're sick. It's a massive part of preventative care, too.
And as you can see, there are a lot of different tools in the toolkit. An ECG, for instance, is basically listening to the rhythm of your heart. A comprehensive blood test, that's like a deep dive into how your liver, your kidneys, and so much more are functioning. Each one of these tests gives us a different piece of the puzzle, and together, they build that complete picture of your health.
Okay, so we know these tests are powerful tools, but when is the right time to actually use them? Let's get into some specific real-life situations where getting this kind of screening is a really good idea.
You can see the reasons are all over the map. It might be to finally get to the bottom of that nagging fatigue we talked about. Or it could be for routine management of a condition you already know you have. Sometimes it's for something really practical, like getting medical clearance before a surgery. And here's a big one. Just being proactive and establishing a baseline for your health during your annual checkup. That's so important.
I love this slide because it basically sums up the whole journey. Over on the left, that's the starting point, uncertainty. It's the fatigue, the dizziness, the questions. And on the right, that's where we want to get to. Clarity, reassurance, and a real plan. Diagnostic testing is the bridge that gets you from one side to the other.
Now, I get it. The idea of medical testing can sound a little intimidating or complicated, but the process itself is usually way more straightforward than you'd think. So let's actually walk through what that path to clarity looks like, step by step.
It all kicks off with a simple conversation, a full evaluation with your doctor to figure out what's going on. Then it moves to easy, on-site sample collection. And from there, it's all about getting you answers, fast. You get a quick turnaround on results, coordination if you need more advanced imaging, and, this is key, a clear, easy-to-understand explanation of what it all means. It all leads to a solid go-forward plan.
And check this out. You're not left waiting and wondering for weeks on end. For most of the really important tests, you'll have your results in just 24 to 48 hours. That speed is a huge deal because it means that peace of mind can show up really, really quickly.
Of course, where you go for all of this really matters. Choosing the right partner for your health journey means making sure you're getting top-notch expertise, accuracy you can trust, and care that's all joined up. And this table breaks down what that looks like in the real world. So when you see DHA-licensed physicians, what that really means for you is you're getting proven expertise. Advanced facilities, that's your guarantee of accurate, safe results. Integrated care just makes your life easier, no running all over town. And personalized packages means the care is tailored specifically for you, not some one-size-fits-all approach.
All right, so let's tie this all together. The core message here is really about putting your health in focus. It's about shifting from a passive state of just wondering what's wrong to a proactive state of actually knowing what's going on with your body.
And this phrase just nails it, doesn't it? Clear answers, confident health. It's about more than just getting a diagnosis. It's about gaining the confidence that comes from truly understanding your body. That's what lets you make empowered, smart decisions about your own well-being.
And if there's one thing to take away, it's this. We have to reframe how we think about diagnostics. It's not some scary tool just for finding problems. It is a positive, empowering way to build a real foundation for lasting health and, honestly, to get some genuine peace of mind.
So we'll leave you with this question to think about. We basically laid out the map.
that takes you from uncertainty to clarity. That map is now in your hands. So, what's the first proactive step you're going to take on your own health journey?